Welcome back to Good Company. We are out here at Aesthetics at Illinois Eye Center for a very special edition of the show. Well, we just gave you some of the fundamentals of skincare and getting your skin looking great to kind of go on to that next step. So a lot of you are probably familiar with injectables and fillers. And Dr. Cuite, tell us why you think that's a great place for your clients to start.
Sure. Injectables and fillers allow a patient to dip their toe in the pool and not necessarily swan dive first thing. The injectables and fillers are affordable and for the most part have zero downtime. So especially in this economic climate, that's a great way to make an aesthetic investment without affecting your work or personal life.
Absolutely. And do you think that people kind of have a fear maybe of injectables and fillers because some of the things that they've seen in Hollywood and magazines and things?
Don't you think? I completely think they do. And we do a lot of teaching with our clients about our philosophy, which is that the work that we do should just enhance you and improve you, but keep the integrity of who you are, your nationality, things like that. So we like our work to be unnoticed. I usually tell my patients, if they say you look relaxed, we hit the nail on the head.
That's great. And so in terms of achieving that result, how do you decide what's best for your client? What does that conversation look like?
Right. It's an exam and a conversation. We do detailed photographs of each patient, and Michelle and I look at them together. We identify what we think are the big areas for improvement. And then we, of course, listen to the patient, because sometimes what strikes me isn't what strikes the patient. So prioritizing the patient's priorities really matters to us. We want our work to echo their priorities.
Absolutely. And part of that educational process is setting up people's expectations of the results that they can expect as well, right?
Sure. And in Peoria, we usually do our work slowly. Since most of my clients want to be under the radar, we do a little bit, and we see them again in a little while, and we do a little bit more so that they can maintain their privacy. In this market, privacy and discretion are really important.
Absolutely, and I imagine that's comfortable for anyone as well, because like you said, it's kind of dipping your toe in the water. So if you kind of do it gradually, you get comfortable with that.
Absolutely.
So in terms of injectables and fillers, what of the injectables or fillers are best for what types of issues that people might be having?
This is a great question. We do a lot of teaching about this. All the fillers that I use are hyaluronic acid based, which means that if we were to want to remove them or reduce them, we can do that with one injection and they turn to water.
Oh, wow.
So there's a reversibility that helps our patients be comfortable.
Okay.
And then within that family, we use 6 different fillers with different properties. They have different viscosities, different resilience. And so whereas I might use a filler called Bellatero or Silk in the fine lines around the mouth, when I want to restore a cheekbone, I'm going to use a more robust filler like Voluma.
Absolutely. And, you know, it's just so amazing the things that you can do and the education that you do. You must get so much reward out of seeing people's, you know, kind of personalities come back when they start feeling like themselves again.
Yeah, that's exactly it. And I think folks who don't know about aesthetics might, from the outside, think it's about how you look, or from the outside, it's people who want to look different. And that really isn't it. Good aesthetics addresses issues of confidence. We all have little things that bother us about ourselves. And when you can address those issues for a client, they literally glow from the inside. And it's about confidence, self-confidence, putting your best self forward, feeling like you're doing that. The patients are so grateful. It's extremely rewarding work.
Absolutely. Well, I know that you and Michelle do a great job of keeping your clients and patients comfortable here. This is a great place. So when we come back, we're going to be talking about a brand new procedure that you guys are offering. So guys, stay right here, and we'll be right back with more Good Company coming up next.